All right, we're going to go ahead and get started today. I'd like to thank you guys for joining us. This is our first UF Health webinar that we're having for the community today. And I'm really excited. It's been quite a learning curve and a growth opportunity for me personally to give people a chance to hear what we have to say and give them a chance to, in the safety of their homes, get some great information and learn more about a topic that I think is important for every single person, their own selves, as well as especially important if you're a parent. So I want to just do a couple housekeeping things. If you have a question that you'd like to ask, if you look at the bottom of your screen, you should have a box labeled Q&A. If you click on that and you want to ask a question, you can type your question there and I'll see that question and we'll be able to help get that question answered for you closer to the end of the seminar, or if maybe you need to send me a message or something like that. I'll see those questions there. And we're anticipating ending about 12:30 or so, and but not an exact time because we're trying to figure all the timing on this quite out, and I'm not sure how many questions we'll have. But when our seminar is done today, you're going to get a survey. When you close out of this, it's going to give you a survey. And I'd love for you to let us know what you thought about things today or any feedback you'd like to provide us. That's really helpful for us and lets us know how we can improve. Also, let me know what was a good feature for you and any other topics you might want to hear about in the future. And also, if you'd like to get on our list so you can learn about our next seminars that we have, that's a good way for you to do that too. It'll allow you to provide your information there, and that will come to me as well. We also have one more webinar coming up in next week, a week from today. It's about parenting children with ADHD. So if that's a topic that's of interest to you, next Tuesday, June 9th at 2:30 in the afternoon, we're going to have another webinar. And just like this one, it's going to be recorded. So if you can't catch it quite at that time, sign up for it. We'll record it. And as soon as the recording is ready, then it'll send you a link out so you can get that and watch that. It'll be on our website. So we have a great speaker today. I've heard her speak a couple times before. We have Dr. Mary Wagner, who is our pediatric sleep program director at UF Health. And so I'd like you to welcome Dr. Wagner. And Dr. Wagner, I'm gonna let you take it from here. Thank you.
Okay, thanks, Marcia. All right, so if you have questions, please type them in for Marcia. We're going to talk about some tips for better sleep. And since I take care of children, we're going to focus on that. But many of these tips work for adults as well. Let's see if I can make this work over here. Okay, so as you all know, this spring has been quite a challenge due to a number of issues. Many of us are working at home. There are few or no daycare options. Parents are having to do school at home. In addition to that, there's been a drastic decrease in opportunities to get out of the house and do some of the activities that families, parents, and children have been doing independently. This, in many instances, has led to a more relaxed sleep schedule, which makes sense if you don't have to get up for school or work. You can certainly adjust your schedule accordingly. The good news here is that people may be getting more sleep. The bad news can be that when we return to our typical schedules of school and work, going to bed at an appropriate time and getting up at an appropriate time may be more difficult. So we want to remind everybody why we sleep, and sometimes I actually have this discussion with my school-age kids. They can usually tell me that they're resting their body, but it also is a time when we let our mind rest, but it's actually a time of a lot of activity within the brain. And in fact, it's an important time where the brain consolidates any newly learned material. It helps organize those facts so your brain can find them the next day. And this is particularly important for our children who are spending a large majority of their time learning. And that's really sort of one of their major activities is learning. When I have kids in the office, I'll throw a pile of papers on the floor and tell them, gosh, look, those papers are really disorganized. What sleep does is helps your brain take those papers, organize them, so that you can find that information the next day. And many of you who have kids or don't have kids know that sleep need does change, and it varies with age and development. And so as our kids are growing and developing, not only are their bodies growing and developing, but their sleep is changing as well. And their sleep changes quite a bit, particularly in the first couple of years of life, but that change continues through adolescence. And we think that although we have certain recommendations for the amount of sleep people need, there's certainly individual variation, and really it's a personal journey to kind of figure out how much sleep do you need, how much sleep do your children need, how much sleep do we need to sort of get along and be able to function the next day. And so here's a chart from the American Academy of Sleep Medicine, and if we look at the green zones, we can see that sleep need decreases with age, but if you focus on the 13 to 18-year-old age group, it's not nearly as low as most teenagers think it is. Most 13 to 18-year-olds need 8 to 10 hours of sleep, not the 5 or 6 that they might think that they need. And again, even children and individuals who are at the same age may have a significant variation in their sleep need. People have a different tolerance for sleep deprivation. Others really cannot tolerate not getting adequate amount of sleep, and they just fall asleep anywhere. And so at any age, we need to recognize what those signs of sleepiness are. It may be overt sleepiness during the day, which means falling asleep at school, or falling asleep on a long car ride, or falling asleep in the bathroom, or at a meal. Trouble getting up in the morning can also be an indication that there's not enough sleep. Longer sleep duration on weekends, particularly when we have a different schedule on weekdays versus weekends, can also be an indication that there's not enough sleep during the week. And napping in school-age children. So school-age children, and by this I mean about 6 through early teenage years, is the least sleepy time we are of our life, and children should not be napping. So if they are napping during the day, that's an indication that their sleep is either inadequate in duration or perhaps being disrupted. We also know that there's other signs of sleepy behavior that particularly affect children. Those signs can mimic ADHD. Impulsiveness, hyperactivity, aggressiveness. They can be very moody and have trouble paying attention. We also know from testing that too little sleep can lead to both learning and thinking deficits, poor abstract thinking, decreased creativity, poor memory, decreased vigilance, poor attention, which we've already mentioned, and motor skills. And one of the ways I try to sell getting more sleep to my teenagers is psychomotor vigilance translates to not being very good at video games. This also impacts our drivers. So we need to be aware that too little sleep can impact your ability and your reaction time. And again, this too little sleep can actually mimic ADHD symptoms. And I've got a little chart here, and this is from the Sleep in America polls, and the Sleep America polls picks one question every year, and they ask people to respond to that question. This is from several years ago, where they were asking families to weigh in on how much sleep their children were getting at different ages. And what I want you to focus on is the fact that despite recommendations in each category, children of different ages were getting less sleep than the recommendations. So the reality is, because of our society, because of pressing needs, whether it's activity or schoolwork or work, we're often getting less sleep than is recommended for age. Young children sleep a lot. By age 2 years, the average child has spent about 9,500 hours asleep, about 13 months, versus 8,000 hours awake. So they've actually slept more than they've been awake. Somewhere between ages 2 and 5, that time awake is equal to the time asleep. And in school-age children, sleep still should be occupying 40% of the 24-hour day. And as I already mentioned, although our adolescents think that they don't need very much sleep, they need more sleep than they think. Again, here's our chart to remind us in the green zone is where we want to be in terms of different sleep durations. So what are you supposed to do with this? Well, I think one of the important things to do is to try to determine what is a sleep need for all members of your family, for yourself, for your children. And then we need to examine the current sleep schedule and try to figure out, is timing a problem? Meaning that, are they going to bed too late or too early to be able to get up and engage in the activities that they need to do during the day, whether that's work, school, practices, or any desired activities. We want to be alert to inappropriate napping. Kids should be napping up through about age 5, but our 5 to 12-year-olds should not be napping, and our teenagers, although they're objectively more sleepy, shouldn't be napping either. So we're looking for signs of overt daytime sleepiness. Again, are they falling asleep during school times? Are they falling asleep while they're trying to do their schoolwork? Are they falling asleep watching TV? Are they falling asleep in the bathroom? Are they falling asleep on a long car ride? And we need to recognize that even though we may have adopted a schedule where we're going to sleep later and waking up later, we can move that sleep-wake schedule around as long as we respect what our sleep-wake cues are and also have some understanding about what circadian rhythms are. And we're going to talk more about that in a minute. I think the other thing that's very important, we've had a lot of free time at home. We've had a lot of families trying to sort of organize what they're doing. It's probably helpful to establish some type of a daily schedule. So when kids are going to school and parents are going to work, we have a daily schedule. I think it helps cue people in about what's expected. So we should have not particularly a set time, but sort of a generalized timing for meals, schoolwork, including outside play and activities. But more importantly, we need to establish a bedtime routine. And there's some studies that show the parents are happier with their kids' sleep when they just establish a bedtime routine. We want to set that sleep onset time and offset time to allow adequate sleep for the child's need and the child's age. And the bedtime routine should be signaling to our kids that we're going from high activity level to a lower activity level and help them settle down for sleep. We can involve our kids in choosing the components of our bedtime routine, but parents need to set the limits. So parents make the menu, kids get the choices. So that might include a bath, a shower, snack, brushing teeth, maybe a reading, either the kid reading to parents or parents reading to the child, those sorts of things. Maybe a massage, whatever works at your household. I think we should also be aware that there are some kids that are alerted by a bath, so maybe bath at night is not the best choice for them. We also want to establish a good sleep environment. No screens for 1 hour before bed. By screens, I mean phones, TVs, computers, handheld gaming systems. And the reason for this is that the light that's emitted from those particular electronics is the most powerful cue for wakefulness. So while we are trying to get our kids to settle down and go to sleep, we don't want to give them cues for wakefulness that will confuse their brain. We want the environment to be quiet at a comfortable temperature, no screens in the bedroom, again, no TV on, even if it's on with the volume down, and that includes the cell phone. We want to have dim lights and usually a transition object other than the parent, because the parent needs to go take care of their business at night and go to sleep on their own. I think it's also helpful to understand that kids are watching what you're doing, so try to lead by your own good sleep habits, having an appropriate sleep environment, not having screens on in the bedroom. And that will improve your sleep as well. We want to stick to a sleep onset offset schedule like we would during a school week, 5 to 7 days. The weekend schedule can vary slightly, but we don't want it to be drastically different because then it is hard for kids to make that adjustment between a weekend and a weekday schedule. And while some people can make that adjustment easily, others have a lot more difficulty scaling back their bedtime and going to bed earlier on Sunday night. We also need to understand what's our circadian preference. Are you a night owl or a lark? When teenagers go through puberty and development, most of them have what we call a delayed sleep phase, which is they become night owls. Their brain tells them to go to sleep later and wake up later. Again, we can move that sleep onset and offset timing earlier if we understand what the cues are and use the right plan. And we're going to talk about that. So for our relaxed sleep schedule and our night owls, we know that they prefer a later sleep onset and offset. This is not a problem if you can get up and do your business. But if your child is going to sleep at 2 in the morning and not getting up until noon, when we get back to school time and they have to get up at 7 in the morning or 6 in the morning to catch the bus, we're going to need to make some adjustments. And what we have to understand is that most people have trouble falling asleep before their internal learning signal starts shutting down. So there's 2 things that govern our level of alertness during the day. One is how far we are from sleep, which makes sense. The further we are from sleep, the sleepier we should be. But that's not the only system that's impacting our level of alertness. All of us have a pacemaker inside our brain that puts out alerting signals to help us stay awake when we're getting sleepier during the day. And so we need to understand that that alerting signal starts ramping up as the day goes on and we get sleepier, and it's ramped up quite a bit in the evening time so that we don't fall asleep with our face in our dinner. We can move that signal timing around if we understand what the approach is. But that is why we need to understand that we need to leave plenty of time to be able to adjust our sleep onset and offset to an earlier time so that we can get up to go to school or work. And that needs to be done gradually. Well, so how do we do that? Well, we need to understand circadian rhythm means about a day. Most people's circadian rhythm is about 24 hours and 20 minutes. And that is why it is easier to go to sleep later and wake up later than it is to move that back. It's harder to turn that internal alerting rhythm off. So one way to do this is to determine a typical sleep onset for your child. I don't mean time in bed, I mean sleep onset. Then we want them into bed 20 to 30 minutes before their typical sleep onset, not 2 hours. Because if you put them into bed 2 hours before, then they just do curtain calls. They come out and tell you they need a drink of water, they forgot to tell you that they loved you, they need some work done by the morning, they got to go to the bathroom, those kinds of things. So we want them to associate the bed with going to sleep, not with making curtain calls. So then what we want to do is set an appropriate wake up or offset time. And when they're falling asleep quickly, what we do is move the sleep onset and offset time earlier by 10 to 15 minutes every 3 to 4 days. What we are doing in that instance is just coaxing that internal pacemaker to turn off a little bit earlier. If we make bigger jumps, what happens is the pacemaker cannot adjust and kids will just stay awake. So what we're gradually doing is moving our sleep onset and offset earlier in 10 to 15 minute increments. And you can see if you want your kid to go to sleep several hours earlier, this can take a couple of weeks. While we're doing this, it's important to keep that schedule 7 days a week so that they don't get off kilter and stay up a lot later on the weekends, which will make it that much harder to go to sleep earlier as we're trying to transition into a schedule that allow them to get up for school or you to get up for work. So the other thing we need to understand is we want to avoid caffeine intake, including sweet tea. We want to avoid vigorous exercise 2 hours before bed because vigorous exercise is alerting. In those who are older than 5 years, if they have to take a nap, we want to limit that nap to 20 minutes. And the reason for that is that if they sleep longer, they will get into deep sleep. If they get into deep sleep during that nap, it will be very difficult to wake them up. And if you manage to wake them up, they will be very groggy. And also it's that getting into deep sleep on the nap that decreases the sleepiness level and makes it harder to go to sleep at night. We want to be aware of what medicines that they take and when they're taking them, and do they have any impact on their level of sleepiness or alertness. So we want to make sure that we're giving medicines that make them sleepy at bedtime and alerting medicines in the morning. Once they go to sleep, Dr. Wagner's rule is no fun at night. So no fun during the sleep period. No snacks, no screens, no extra attention. If you have to attend to something in the middle of the night, we need to do it in a very matter-of-fact manner. We don't have quality time in the middle of the night because parents need to sleep. Try to remember to reward the good when they do what you want them to do and ignore the bad. If they're up at night doing what they're not supposed to, try to be very matter-of-fact about it and say, gosh, we just don't do that. I think the other thing we need to think about is when do we talk to our primary care provider? I think the times that we talk to our primary care provider is when we have extreme daytime sleepiness, when we think our children are getting adequate sleep duration, and if we think their sleep is disrupted by kicking, restlessness, snoring, or breath holding. All right, again, I just want you to be aware that we have different sleep durations that range in age. Our 12-month-olds are needing to sleep anywhere from 12 hours to 16 hours. Our toddlers are sleeping anywhere from 11 hours to 14 hours. Our 3 to 6-year-olds, 10 hours to 12 to 13 hours. Our 6 to 13-year-olds, 9 hours to 12 hours. And then most importantly, our teenagers need 8 to 10 hours of sleep, not the 6 that they think that they need. Oops. Okay, and that's it. Coach Mullen wants us to remember we all need to get more sleep. And I'm open to answer any questions. Marcia, got anything?
Okay, yeah, we have a question here. So One of the questions that we got from the audience was, do you think that like teenagers, when they have a hard time, they already sleep later in the day, do you think that schools start too early for kids and that maybe should change like the time school starts?
Well, that's a really good question. The American Academy of Pediatrics has actually understood that early school start times and too little sleep is actually a treatable public health problem. And the American Academy of Sleep Medicine several years ago put out a statement that said school start times for middle and high schools should not be before 8:30 in the morning. Now, how school systems adapt to that sort of depends on the school system, but that's absolutely true, that if we have what we've seen with teenagers in particular, is that when they get more sleep, when they delay school start times, that they actually get more sleep. And we know that too little sleep in teenagers is associated with a number of problems. And when we prove that, they do better on test scores, they have fewer problems with depression, they do better academically. We also know from a couple of studies that when you delay school start times and kids are getting more sleep, it actually decreases automobile accidents. So there's been a couple of states that have looked at this and proven this. I think where you run into sort of the machine is trying to figure out, gosh, we can't start school later because we have practices after school or we have this, that, or the other thing, but it really too little sleep is a public health problem, and absolutely 8:30 should be the earliest start time for both middle school and high school, but particularly for high school. Because remember, our high school kids are driving, and this is an age where we don't want them to have impaired psychomotor vigilance. We also don't want their judgment to be impaired because they've had too little sleep, because we already have some judgment issues, potentially, not for all kids, but sleep definitely compounds those things. So that's absolutely correct. Anybody else?
Okay, we have another question. This is Marcia again. Is using melatonin to get your child to go to bed, is that a good thing, a bad thing? Can you kind of elaborate on that a little bit more?
So what actually happens naturally in us is we have what's called dim light melatonin onset when the sun starts to go down. And so there's two ways that I use melatonin in my clinic. One is it's sort of that kind of cue and that's usually about 5 hours before sleep onset. So I sometimes use a 0.5 milligram dose before 5 hours before sleep onset to sort of cue that in. And then for some people, a larger dose, kind of out of focus again, a larger dose closer to sleep onset time is useful as well. Okay, and for those patients, some people have a great benefit from that, recognizing that melatonin is not controlled by the FDA, and so it's really considered a nutritional supplement. And when you buy it at the health food store, the grocery store, or wherever it is, what may actually be in that melatonin bottle may be variable. But I think in kids or adults who are having trouble sleeping, it's certainly worthwhile to try. But the thing you need to understand is that if your kid is going to sleep at midnight, giving them a big dose of melatonin at 7 p.m. will not make them fall asleep at 8. We have to gradually change sort of their circadian rhythm so their alerting signal is turning off earlier, and the way we do that is in gradual little bits. So absolutely it can help, but it won't bridge a 2 or 3 or 4 hour gap in sleep onset time.
Okay, we have another question from the audience. What temperature would you recommend for a bedroom? And then also, could 20 minutes of reading in bed hinder your child's ability to fall asleep, or is it helpful to wind down? So 2 questions.
So I think that's a really good question, and it sort of depends on your kid in terms of what we want to be doing is reading, but reading something that's not too exciting. We don't want a big page turner, and we don't want the lights to be too bright when they're reading, because we don't want that light to go to our eyes and cue wakefulness. I think in kids that are having a lot of trouble with sleeping, I would tell them to use the bed only for sleep and have them read in a chair beside the bed. If you have a kid that falls asleep pretty quickly without big problems, I think you can read in bed for a few minutes, but if it's an hour or much longer than that, when it's taking them to fall asleep, I would move that reading to a chair in their room. And I think reading is a great way to settle down. Other things that can calm people down if they're having trouble sleeping, besides reading a boring book, is actually taking a piece of printed material for kids that know the alphabet and have them go through and circle all the O's. That's what one of our clinical psychologists recommends. Something boring. So we don't want the reading to be too exciting at bedtime, because we don't want them to want to sneak in the middle of the night and you come in and find them under the covers with the flashlight in the book. We want to encourage reading, but that reading at bedtime needs to be something a little calmer and something that's a little bit less engaging.
Okay, and then one of the other questions that was with that person's was, what's a temperature that you recommend for?
Oh, okay. So I would say cool and comfortable. Okay. And, you know, there's a lot of data that actually suggests that temperatures down in the 60s are good for your brown fat. I would say whatever's comfortable in your house. So you don't want it to be too hot. You don't want it to be too cold. You want to be able to be in bed with a light cover without having to have a lot of extra clothes on. So, you know, 72 to 75 degrees, depending on what your personal temperature, you know, sort of gauge is.
Okay, someone says, thank you for this presentation. And then they also ask, do you have any suggestions for a 5-year-old who in the last couple of months has started waking up multiple times during the first half of the night?
I would just say that, you know, this has been a very stressful time. And a lot of the patients that come to my clinic, particularly kids who have a little bit of separation anxiety or want to be around their parents, have capitalized on the COVID restrictions and they're around their parents all the time. So that separation can be quite a problem. So if you think your kid is anxious, what I would say is that's something you should discuss with your pediatrician. But one thing I would remind everybody is you want them to go back to sleep at 2 in the morning, how they went to sleep at 7 or 8 o'clock at night. So if you are physically present in the room when the kid goes to sleep at 7 or 8 or whenever their bedtime is, and then you sneak out of the room, if they wake up, then they're going to say, where's my adult? I need my transition option to go back to sleep. So how they go to sleep at night is very, very important. And also what's happening when they awaken. So if they do awaken, you want to deal with that in a very matter-of-fact way. But there are some kids, particularly at this age group, that will have confusional arousals, night terrors, or sleepwalking. That can be made worse if your sleep is more, the schedule is more disrupted, but it can also be made worse if the kid is snoring or kicking, okay, because some families have the restless legs, and so that feeling like you need to move can be manifested. It can be worsened when we lay down at night. So that might be something to talk to your pediatrician about in terms of, are there things disrupting this kid's sleep that make it harder for them to settle down? So we want to look at the environment, make sure the environment is quiet. We want to see how they fall asleep at bedtime. So if you're there at bedtime, then they're going to expect you to be there when they have a normal awakening. But in that first part of the sleep period is when we see kids waking up with what I would call a family of confusional arousals. They sit up and they're kind of groggy, or sometimes they try to get out of bed, or sometimes there's a blood-curdling scream, and it's fairly common at this age group.
Okay, we had one more question about kind of what you were just discussing about sleepwalking. So if you have a child that sleepwalks sometimes, I always hear it's a bad thing to wake them up. Should you just...
Oh, that's a really good question. So the first thing we want to do is make sure that they're safe and they can't escape from the house. Okay. The second thing is to recognize that that is really what's happening when kids are sleepwalking and having those confusional arousals, is that when their brain is switching through different stages of sleep like it normally should, it doesn't quite make the switch cleanly. And so part of their brain will wake up and they do things that sort of make sense. Like they may get up and walk around, but they might go into the bathroom and pee in the bathtub. Or they might go into the kitchen and put the phone in the refrigerator. It kind of makes sense, but they don't. Often their eyes are open when this happens. Triggers for this can be if your sleep schedule is a little bit more disrupted. If something is disrupting the sleep, whether it's extrinsic, dog, snoring, or intrinsic, obstructive sleep apnea or kicking can definitely make that worse. And it's often more common in families whose parents have a history of sleepwalking. So if you can keep a sleep log and figure out what time the kid usually sleepwalks, and I would look at the sleep onset to the time when they usually get up. If you can establish pretty close to that time, you can do something that are called scheduled awakenings. And that is about 15 minutes before they would typically wake up. You gently awaken them for a week and see if you can interrupt that cycle.
Okay, we have one more question. Do you recommend melatonin to help with sleeping?
I do not, I don't, if you are not having trouble sleeping, I would not use melatonin. Most patients, by the time they've made it to my clinic, have tried melatonin. But I think, again, what we want to do is we want to understand what the limitations for melatonin are, and that what your body secretes is a much, much, much lower level than anything that we get at the health food store or anywhere else. Okay. And remember how we use it. One way to use it, again, is a small dose 5 hours before sleep onset to sort of mimic our dim light melatonin onset, but keeping in mind that if we're not falling asleep till 2 in the morning, a big dose at 10 isn't going to make us fall asleep at 11. So then we have to use our melatonin closer to our sleep onset and move everything up gradually. So I think that it's perfectly reasonable to try. And I think we always want to be careful because how melatonin, one kid responds to melatonin may be different in the next child, and all parents know that sometimes their kids will react differently to different medications, but it's certainly worth a try. But I think you also want to do some of the other things that don't require taking any medication in terms of a good bedtime routine, avoiding screens, eliminating caffeine, making sure that our bedtime routine or our wind down routine isn't roughhousing and running around, the house, that we aren't killing aliens right before bed, those kinds of things.
Okay, we have another question. If you have a child that has a hard time falling asleep and staying asleep, and the child tells you their brain won't turn off, is there something the parent can do?
So that is a really good question, and it sort of depends on the age of the kid for that. Yeah. And so one thing you can do is, if they're a worrier, try to figure out, do you have a kid that has anxiety that needs a little bit more help, and that might require a visit or some tools from a clinical psychologist. But one thing you can do is have them do a worry list before bed, and have them write down the things that are worrying them. And particularly if they're talking about, if they're talking about what it is that their brain is concentrating on, sort of talk with them about it before bedtime and see if you can sort of get that out of the way. I think that is a very common problem in kids, and it's a common problem in people that are having trouble sleeping. So one of the strategies that you can do is employ one of those boring things to do. Like I said, you take a piece of written material like the newspaper or magazine, circle all the O's and see if we can't be focusing on something much more boring before bedtime. I think, a lot of times kids want to sort of blurt out everything that happened during the day. Remember, the other thing to remember is that young kids, they don't really care if they sleep. They don't care if you sleep. They don't care if the neighbors sleep. It's just the way they are. So they don't see sleep as the essential that adults do, many of them. And if you think about life from their perspective, we never take a young kid, a 5-year-old, a 2-year-old, a 3-year-old, we don't take them to the backyard at 9 in the morning and kiss them on the forehead and say, I'll pick you up at 5. There's an adult within arm's reach of them all day long. And then at night, we put them in the room, we turn the lights off and tell them to go to sleep. And many of them are like, where's my adult? What's going on here? This seems quite different from what happens during the day. So there are a number of things that can come into play there, particularly for kids that tell you that their brain won't turn off. So trying some boring, relaxing activities, trying to make sure that they, if they have any worries, we're appreciating what those are, writing down our worries on a list so that we can deal with them in the morning. I have one that used to tell me, start with questions at bedtime. Why are we on this earth, is what he would say. Say, you know what? People have spent their whole life trying to figure that out, and we're not going to figure that out tonight. And so we will talk about that in the morning.
Okay, we just have another question. Is it a good idea to wake up a teen by a certain time if they're wanting to sleep late in the day, or is it better to allow them to wake up on their own schedule?
Well, I think what you have to do is that's part of that circadian rhythm thing, is figure out what is the circadian rhythm, what is their natural sleep onset and offset time. If they can get up and do their business, if they're doing Florida virtual school or whatever it is, I don't have a problem with it when they sleep. But if they can't get up and do their schoolwork, or they can't get up and make it to school, then I think you have to talk about, do we need to move that sleep-wake schedule around? So you don't have to sleep at a particular hour if you can get up and function during the day. And I think for your teens, you want to be very clear that we don't want them driving sleepy. And I would urge parents to use that leverage. You know what, we have this talk in my clinic all the time. Driving is not a right, it's a privilege. And this is one way that parents can definitely exert some influence over about what their kids are doing in terms of making sure that they're getting adequate sleep. We don't want sleepy kids behind the wheel of the car. We don't want them to be hurt. We don't want others to be hurt. It's the last thing that parents want to have happen. And so I would say if that teen sleeping late can manage their business, get done what they need to do, I don't really care when they sleep, but if they have to get out, if they're missing school, if they're missing out on activities with other teens because they're sleeping, then we want to be a little bit, we want to help them move their sleep-wake schedule around. That being said, that is very hard to do if the teen is not motivated to do that. Doesn't work very well when mom is motivated to do it.
Okay, last question. Do you have any thoughts on melatonin in the extended release form?
So I think that can be useful for people who have trouble staying asleep at night. So if you have somebody that falls asleep okay, or even they're having trouble falling asleep, but then they're having a lot of awakenings, sometimes a combination of a small dose of short-acting and long-acting melatonin at bedtime can be useful to help sort of cover them through the night. Most people tolerate melatonin very well. What you want to do is make sure that it doesn't have any impacts on the next day for them. Okay.
Okay, we have actually one more that came in. If you notice behavior that looks like ADHD, but you also know that the child is not getting enough sleep, is it time to consider a sleep specialist, or which direction should they go in?
Well, I think you should at least start with your pediatrician, because parents know their kids very well and understanding what those behaviors are. And absolutely, it would be simplistic to think that all kids with ADHD just didn't sleep well, but there's definitely, we know that kids with ADHD who don't sleep well are going to have more trouble with regulating their activities during the day, and that those symptoms can definitely, symptoms of ADHD mimic those of too little sleep. So I think getting some help from whoever, a sleep specialist or your pediatrician or whoever, to help you get the kid to sleep better. Most parents would say, yeah, we need to sleep better before, so that we know that too little sleep is not having a negative impact on daytime behavior. And if you've not seen this, just go to Publix on Saturday afternoon and you'll see the family, maybe not now, but in the past, if you take your kid and the 2-year-old's having a meltdown because they went for a trip to Publix rather than a nap, there's not much you can do with that. So I think definitely if you are concerned about daytime behavior and you're concerned about sleep, the place you start with is with your pediatrician. If your pediatrician feels like they need more help, that's something that we deal with in sleep clinic frequently. Okay.
Okay, so we are gonna wrap it up from there, and I'd like to thank everybody for joining us this afternoon. And if you know someone that wanted to attend this, like I said, we're gonna have the recording up on our website in a few days, and they can check it out there. I'd like to thank everybody for participating today, asking great questions, and I'd especially like to thank Dr. Wagner for taking time out of her busy day today and by helping us with that. Thank you so much. Thank you.
All right. Thanks for your help, Marcia.
Thank you, everyone. Bye.
Everybody